Hello and welcome. Today we're delving into Down syndrome, a genetic condition affecting both physical and intellectual development. We'll explore its causes, symptoms, diagnosis, and how individuals with Down syndrome can live fulfilling lives. Down syndrome isn't caused by anything a parent does or doesn't do. It's a genetic condition primarily caused by an extra copy of chromosome 21. Normally, a person has 2 copies of each chromosome, but in Down syndrome, there are 3. This extra chromosome material alters development and causes the characteristics associated with the condition. This chromosomal abnormality typically occurs randomly during the formation of the egg or sperm, or less commonly after fertilization. The presence of the extra chromosome 21 disrupts the normal course of development, particularly affecting brain and heart development. The increased gene dosage leads to an overexpression of certain genes located on chromosome 21. This overexpression interferes with cellular processes, leading to the characteristic features of Down syndrome, including intellectual disability, distinctive facial features, and increased risk of certain health problems. Down syndrome affects individuals of all races and socioeconomic levels. It's estimated that Down syndrome occurs in about 1 in every 700 to 1,000 live births worldwide. While the risk of having a child with Down syndrome increases with maternal age, the majority of babies with Down syndrome are born to mothers under 35, simply because younger women have more children. The signs and symptoms of Down syndrome vary from person to person, ranging from mild to moderate. Some common physical characteristics include a flattened facial profile, an upward slant to the eyes, a small nose, and a protruding tongue. Individuals may also have shorter stature, small hands and feet, and decreased muscle tone, known as hypotonia. Health concerns are also common, including congenital heart defects, hearing loss, vision problems, thyroid issues, and an increased risk of certain infections. Down syndrome can be diagnosed during pregnancy through prenatal screening tests, such as blood tests and ultrasound, and diagnostic tests, such as chorionic villus sampling, CVS, or amniocentesis. After birth, diagnosis is typically based on the presence of physical characteristics and confirmed through a chromosome analysis, also known as a karyotype, which identifies the presence of the extra chromosome 21. While there aren't distinct subtypes of Down syndrome in the same way as some other conditions, there are different ways the extra chromosome 21 can arise. Trisomy 21 is the most common, where every cell in the body has 3 copies of chromosome 21. Mosaicism occurs when some cells have the extra chromosome, but others do not, potentially leading to milder characteristics. Translocation is where a portion of chromosome 21 attaches to another chromosome, and the person ends up with extra material from chromosome 21. Understanding the specific chromosomal arrangement doesn't drastically change treatment, but it can influence recurrence risk discussions during genetic counseling. There's no cure for Down syndrome, but a variety of therapies and interventions can help individuals reach their full potential. Early intervention programs, starting in infancy, focus on developing motor skills, language, social skills, and cognitive abilities. Specialized education programs, speech therapy, physical therapy, and occupational therapy are also beneficial. Medical care is essential to address associated health conditions like heart defects, hearing loss, and thyroid problems. A supportive and inclusive environment plays a crucial role in fostering independence and well-being. As Down syndrome is a genetic condition arising during conception, there is no way to prevent it from occurring. Genetic counseling is recommended for families with a history of chromosomal abnormalities or for women who are planning a pregnancy at an older age. Counseling can provide information about the risks and available screening and diagnostic options. The prognosis for individuals with Down syndrome has improved significantly over the years, thanks to advances in medical care and increased social inclusion. With proper support and intervention, many individuals with Down syndrome can lead healthy, fulfilling lives, attending school, participating in activities, and working in various capacities. Recent research focuses on understanding the underlying genetic mechanisms of Down syndrome and developing targeted therapies to address specific health concerns, such as cognitive impairment. There's ongoing research into potential drug therapies that could improve cognitive function and reduce the risk of Alzheimer's disease, which is more prevalent in adults with Down syndrome. This research offers hope for continued improvements in the quality of life for individuals with Down syndrome.